The German ambassador to the Gambia visited the Edward Francis Mortigan Hospital on Wednesday to assess the progress of a micro project funded by the German embassy. The initiative introduced a bedside ultrasound machine to the hospital, a cutting-edge tool designed to enhance patient care by allowing real-time imaging at the patient's bedside. These portable devices, commonly known as point-of-care ultrasound machines, are transforming medical diagnostics by eliminating the need of moving patients to radiology suites for critical imaging. The head of the pediatric unit at the Edward Francis Mortigan Hospital praised the machine's impact, describing it as a game changer in improving workflows and diagnostics at the hospital, which is the Gambia's largest healthcare facility.
Today, we are receiving the German ambassador who is coming to visit us to see the success of funding of a micro project. They gave us some money to buy a bedside ultrasound machine. So that is this probe. And I believe most of the people that are seeing this video, you've seen an ultrasound scan, which is used commonly in antenatal care. So you can see this machine is much smaller. It's basically just a probe. It has two sides, and we are using it with a normal tablet. You can even connect it to your mobile phone if you downloaded the program. This machine now, together with the tablets, allows us to look into tissue, to look inside of the body of our patients on the ward, because many of them are very sick. So it's very tricky to bring them to the ultrasound machine. So with this, the ultrasound can come to the patient.
Dr. Ali Barry, a doctor at the Edward Francis Mortigan Hospital, echoed these sentiments, emphasizing the positive change the machine has brought to patient care.
We are very grateful. When you practice in resource-poor nations, you know the need for every drop of money you get. It goes a long way in helping children who have no hope. This has really changed everything. This morning we were arguing whether it was a meningitis or whether it was a bleed. Once we came down, it was a bleed. So it answers your question without wasting time. If we didn't have this, we would have gone to the ultrasound room to queue up, and maybe the decision will be taken next tomorrow, and it is the cops that would go for the test. Answering questions immediately just makes us not waste our time and not waste the time of people and save life. So we're very grateful.
Acting head of the pediatric unit highlighted the machine's significant contribution to better treatment outcomes, underlining its importance in the hospital's mission to provide quality healthcare.
I want to attest to, the very important use of it. Being a nephrologist, you can't do without ultrasound. And I was quite thrilled when I came here and I found out that we could do an ultrasound in the emergency room. And today again we did one on a patient here who used it, a child who had a pneumothorax, quite ill, and we needed to just make sure. It enables you to do a prompt diagnosis. Instead of waiting to get to the radiologist and so on, you could make a diagnosis. And so for us in nephrology, we find it very useful. Examining of the kidney is very important. Spot on. As you see a patient, you want to examine the kidney, get an ultrasound to know what exactly is happening there. On behalf of the department, to say thank you so much for making this available to us. It has helped practice in a very good way.
Dr. Amadou Barry, a recently trained user of the machine, shared his personal experience, noting how it has greatly improved the hospital diagnosis precision and overall patient outcomes.
From the first-hand experience, I think the ultrasound scan bedside helps a lot in patient management. Before the training, actually, I wasn't that good in ultrasound. I can see images, but sometimes I find it difficult to identify the structures. But with the help of the training, I was able to identify, not like a radiologist, but I think I'm good to go.
The German ambassador to the Gambia expressed his satisfaction with the project's success, underscoring the machine's critical role in strengthening the hospital's capacity to deliver immediate and effective care.
But of course, this duty turns into a great pleasure and to great satisfaction to see how well this support is used and that it's fully brought to its potential, and you're still working on extending the use and training more and more doctors to it. So wonderful.
The Edward Francis Small Teaching Hospital now benefits from a modern diagnostic tool that aligns with international best practices widely used in emergency rooms, intensive care units, ambulances, and trauma bays. Bedside ultrasound machines have become indispensable in contemporary medical care. Reporting for Kerfatu, I am Ramatulai Jao.